All right, let's talk about a recent decision by the High Court in Bisho, which has the Eastern Cape Health Department breathing a sigh of relief. The department has been hemorrhaging cash due to legal claims. The court judgment enables the state to offer rehabilitation and other services for children with cerebral palsy instead of paying the private sector. Let's bring in Dr. Rolene Wagner, who's the HOD at the Eastern Cape Department of Health. Thank you for making time for us, Dr. Wagner. Over the past decade, you have had to pay billions in medical legal claims. These judgments must give you hope.
Good afternoon, Clement. Yes, thank you very much for having us on your show. It does give us hope. As you know, the common law up until this judgment only allowed for payment as an upfront lump sum payment, and that had to be in cash. And so this was draining, as you said, billions of money out of our budget. From 2014-15, where the claims were 75 million in the first year, it rapidly escalated to 921 million in one financial year in 2020-2021. And as you say, from 2017-18 to 2020-21, 2.5 billion rand alone was paid in these medico-legal settlements. With this common law now, it gives us an opportunity to deal with it in a different way. And so we've worked very hard as a province to provide services and ensure we can provide the supplies that is required to a child with cerebral palsy through these rehabilitation centers of excellence and cerebral palsy clinics. Yeah. This has huge implications, as you were hinting.
Yeah. So in essence, this judgment is and may even change the way that the damages are paid. And I imagine this will free a significant amount of cash in the department.
Yes, right now we have just over 3,000 medico-legal claims lodged against us. We have estimated this contingent liability of active claims to be around 30.5 billion rand. So if, for argument's sake, all of these claims had to come before the court and had to be settled, with the old law, or if this law does not stand and it had to be a lump sum payment, it would threaten the liquidity of our department as well as our province, because we would have to come up with the money. Yeah. But the common law, if it stands, as you were saying, we can now provide services, we can supply whatever supplies are required. And the Eastern Cape common law, what we've introduced here is the undertaking to pay. So that says we have our case manager with the case manager of the child, and we agree upfront what is required in the year ahead. And we then undertake, if we don't have the supplies or we don't have the service, we will either procure it by partnering with the private sector, or we will reimburse the claimant for that particular goods. Now, what that means is it significantly reduces the claim. Just in this Noila judgment, that claim was around 34.5 million rand. And by having the services provided through the order and agreeing on the supplies up front, the lump sum payment, including damages, will be around 4.5 million rand only. Yeah. So this is a significant reduction. This is an 85% reduction. And if you apply that 80 to 85% reduction on a 30.5 billion contingent liability, it significantly reduces our liability in the years to come. Yeah, that's quite a significant amount. So what do you do then with that cash that is freed up? How are you going to deal with the issue of patients who are harmed through negligence in the public health system? Because you still need to strengthen the quality of services so that there will be cause for fewer lawsuits. So is there a plan to work on reducing these high-risk pregnancies? Absolutely, there's a plan. And I think before I comment on the plan, the judgment is quite careful in trying to ensure that the child with cerebral palsy, that the litigant in this case, that child's rights are protected. At the same time, the judgment also takes into consideration that about 90% of the people in the Eastern Cape are dependent on the state for services. So it's a bit counterintuitive to make these lump sum payments and drain money out, because then you're just increasing the risk of litigation and decreasing the ability to provide care for others. So this judgment for us gives us hope. We have been implementing a turnaround strategy in our department. We started this in August of 2021 year. We have focused specifically around the medico-legal. There's an integrated strategy where our provincial treasury, as well as the Office of the Premier, works with the Department of Health to ensure that we deal with medico-legal claims in a proactive way, but more importantly, that we prevent future claims. We've made significant investments into machinery and equipment, into staff appointments, into training our staff, and already, touchwood, we're starting to see measurable improvements in patient outcomes and experience of care. But of course, it's only been a year of implementing the turnaround strategy, and it is a 4 to 5 year turnaround. But we are hopeful that by not draining more money out of our budgets, we can now retain the budget and continue with this plan of trying to improve the quality that we're providing. We are looking for a remedy, because the 4.5 billion we've already paid out for medico-legal settlements has really caused us to limp. And so we're working with provincial and national treasury to find solutions to deal with the impact of litigation up until this point. But at least this judgment stops the hemorrhage, as you're saying, and stops it from going into a downward spiral.
What about the argument, Dr. Wagner, that lawyers will be, I suppose, less willing to take medico-legal cases on contingency if the department is allowed to offer services instead of the cash?
Now, this came up during the trial as well, and the judgment does actually comment on that. So it was an argument put forward by the opposing counsel. As you are aware, lawyers can claim up to 25% of the fee. And of course, the bigger the fee, the bigger the amount that 25% translates into. The judge's comment was that, if I recall it correctly, is that 25% just on its own is a significant cut out of the settlement. So in this case, if it's a 30 million rand settlement, 25% is 7.5 million rand. So that means it's already drawing away care that was intended originally for the child. And we have found that children come back into our system. We've also unfortunately found, and this does not apply to all lawyers, but we have had cases where our provincial treasury has investigated payments that we've made. We have found that in certain cases there are some trust fund irregularities. We've handed those over to the Legal Practices Council. 15 of them are undergoing disciplinary processes and 10 are still underway. We have also found what we suspect could be fraudulent claims that were submitted, as well as overbilling. And those are just some of the complications associated with it. The judge felt, however, that it wasn't a sound argument to say that lawyers would not defend children just because their proportion was going to be reduced from this 7.5 million of a 30 million rand amount. We have had experience with the Road Accident Fund where the amendments were done to the Act, and that did not stop lawyers from defending such claims. So the judgment says that they don't think that that's a sound reason for not going ahead with introducing the common law.
All right. So these irregularities, the fraudulent claims, the overbilling as well that you mentioned, is that involving staff in the Department of Health, and where exactly? Is that at a higher level or on the ground in their specific hospitals?
Okay, so what Provincial Treasury has done is they have a forensic auditing unit. They then took all of the claims, those 418 claims, and analyzed those claims. They are working together with the Hawks, and we are working with SIU to further investigate those claims that we believe may be fraudulent. There have been cases that we've already handed over to SAPS, and those will be taken further with respect to the overbilling. And as I said, we've already handed over to the Legal Practices Council. So there's still a lot more investigation that will be going into the individual cases. There are suspected cases of collusion in one of the state attorneys, in one of the state attorney offices in our province. And as I say, those are under investigation, and we will see outcomes associated with that.
How much have you been spending on average on such claims versus what has really been a diminishing budget for the department?
So the number of claims have increased year on year. This is true in both public and private sector. Initially, the claims in the first year, when I go back and check the records, our payout in 1 year was 75 million rand in the first year. Within 2 years, it rapidly escalated to 250 million rand. And then, like I said, from 2017-18 financial year right up until the 2020-2019 financial year, it ranged around 780, 790 million, up to 921 million in that financial year. In the 2021-2022 year, we launched the 2 cases. This was both the writs as well as the undertaking to pay defense. And in that last year, the payout was 44 million rand. So in these cases that were before the court, we were pleading the public health defense, and those judgments were held back pending the outcome of the Noyila judgment. So this judgment is really important to us that it stands. It will stop, as you said, the hemorrhage of funds out and will allow us to retain and offer services to the other 90% of the Eastern Cape who are dependent on state health services.
Dr. Rolene Wagner, thank you for making time for us.